Hello, hello, hello. This is Adelai Brown, your heart coach, and I want to welcome you to another episode of The Heartline with Adelai Brown. I am so thankful for you to be here with us. We are growing heart equity, personal, relational, and financial wealth that we obtain and cultivate through authentic living. And today I am so excited because I have made a commitment to you guys to have conversations and bring people on that really nurture this idea of heart equity. And this guest today really embodies what I'm talking about when I talk about growing heart equity, from the personal wealth, the relational wealth, the financial wealth, just in the sense of her being an individual that is really living this. I think this is the first time I'll say this heart equitous life. I'm just so thankful for her being here with us. So welcome, Dr.
Hi,
LaShana Wilder. Woo.
how you
So
doing?
I am doing wonderful. How are you?
I'm doing okay. I'm doing okay.
That's awesome. Well, I'm thankful for you being here. And if you don't mind, just let the people know who you are. Give us a brief bio introduction. Let them know how you became who you are, and we'll go from there.
Okay, so as you already stated, my name is Dr. LaShana Wilder. I am a doctor of medical science and a integrative physician associate. I am also the co-founder of Magnolia Integrative Medicine with my amazing business partner and sister. I have adopted her entire family, Dr. Sarah Ellis, and our medical director, Dr. Deshwanathan. And we just here we are in the first Black woman-owned integrative medicine practice here in Charleston. So we're pretty proud of that. And it's been a whirlwind. We had our opening week in May, and this is July, and I felt like 2 years passed in that amount of time with all of the work and the sleepless nights and all the things that happened, but we're here. I'm also a published author now with my first publication, Wholeness Awaits. And well, actually, my second publication, but my first book, I'll say it that way. Um, as well as Is Your Mind at Risk is the bundled set.
Mhm.
So, I mean, life has been lifing and we've been doing the things, but I'm just grateful to be here. Like, I truly mean that. I really am grateful to be here.
Well, we are grateful to have you, and just kudos to you. We celebrate you for just staying the course and just having such a wonderful story to tell about who you are. And that's just a little bit about who you are and what you're doing. But as you guys can already hear, you know, this woman has a wealth of information for us, and I'm just excited to get into this conversation. So, you and Dr. Sarah,
Mhm.
and the first woman-owned, Black woman-owned integrative medical practice in Charleston. How did this come to be? What got you all to this space of being, in integrative medicine? One, what is integrative medicine? And two, how did you get here?
The story is really cool. I love the fact that I'm here with you because you actually created the space for it to happen, not even realizing that this was going to come out of it. But I was on a prayer call that you were hosting, and I don't even remember what the conversation was about. We were just being really authentic, talking about our experiences, etc. No idea. I can't recall exactly what we were talking about. But another woman on the call, Yolanda, she actually is one of our patients who is amazing. Um, but she heard what I was saying and something, came to her and said, you know what, I'm going to connect you with Dr. Ellis. Okay. No problem. I would love to meet her. She's also from the island, Charleston, born and raised, etc. And I was like, okay, it would be amazing to meet her, right? So I think she exchanged our information. She shared our information. And it was a few months after that call that Sarah and I actually connected. We met for coffee and had a conversation about all the things, healthcare, our community, what we wanted to see change, how we wanted to see it changed. And it was so funny. We were literally completing each other's sentences. And she spoke, as we were talking over coffee, she spoke a line that was in the book that I was writing at the time. The book was not even done. It was honestly the introduction. And it was about how people who have been marginalized for a long time, how it really is our birthright to be able to live in abundance. This is a promise from God. And abundance doesn't necessarily just mean financially or with
Mhm.
stuff, it's in every facet of our lives, right? Whether that's mentally, physically, emotionally, those things are promised to us from God. And I was talking about that in the book. And she said the line. I said, "Are you in my computer? Like, this is really crazy. This is crazy." And after that, she and I felt like we knew each other for years. And we really had the same vision. And she said to me, she said, "Shana, there's a place for you." And I said, "Well, what do you mean?" And that was when the conversation about Magnolia started. When she said, "We got to do this, we have to be in position." And
Mhm.
it was on from there. And Magnolia Integrative Medicine was created from a meeting over coffee and a connection in a prayer call. So it was a crazy story, but it has been such a blessing since that time. I it just feels like a lifetime has passed by.
Mhm.
But yeah, that's honestly how we started. We had just the same passion towards our community, the same urgency that they needed us in a place that was different. We didn't want people to feel looked over or rushed or, you know, minimized their feelings, but we also recognized that to understand cultural experience affects how you receive your health care.
Yes.
And that's a place that's missing. And that's one of the reasons why there's so many different disparities within, the Black and Brown community is because of that, just not understanding those cultural relations. So we just felt like, we had to fix it. So if you see a place that need to be fixed, we just did it. And you asked, what is integrative medicine? Integrative medicine is just that, an integration of holistic practices within your traditional allopathic healthcare. So think about it as an additional toolbox that you can draw on if you need help within whatever your, healthcare challenge may be at the time. Um, so that is what that looks like is incorporating lifestyle, but also incorporating some nutraceuticals, herbal medicines, and traditional ancestral practices to be able to facilitate and oftentimes reverse disease that people have been dealing with for a lifetime. So I'm just excited to be able to offer that toolbox to our community.
Wow.
Mhm.
That it's so many things that my mind is just all over the place right now. Because I feel like one of the things that we all need to understand is we need to think more about ourselves and what we bring to the table, right? I thank you for highlighting how my role and how you all made that connection, because just to give the audience a really good timeline, you said the practice started in May.
Mhm.
This prayer call that she's talking about took place within the first and second week of October of
Mhm.
2024, right?
Mhm.
And it literally was me bringing Heart Talk back after not doing it live for a while, over a year. And I was trying to find a way to deal with the grief of losing my mother that March prior. And I felt that I needed, it was a 10-year anniversary of Heart Talk. September made 10 years. And it was time to bring it back. It was time to go live. And we do Heart Talk still every Tuesday. Now it's every Tuesday night at 8 p.m. It's live on YouTube, and you can also get in via Zoom. But I want to highlight that because I held the space for the call, but I wasn't the one that necessarily made the connection, but I held the space, right? Just like Magnolia Integrative Medicine now, Dr. LaShana and Dr. Sarah and just everybody in the practice, Dr. VT, like they're holding a space for more people to come in and make these amazing connections and be healed. But I want people to understand the power of thinking enough about what God put on your heart to do, what God told you to do, that thing you keep putting off, that podcast you might maybe you are supposed to start one. Maybe you are supposed to write a book. Maybe you are supposed to move to this new city, or maybe you do need to, whatever that new thing is, maybe you need to lean into it. Maybe you do need to log on to the prayer call your friend been inviting you to for the
Mhm.
last 5 years and you never got on. Maybe tonight is the night to do that because you don't know what's awaiting you when you get there. You don't know what type of connections you make that will change your life in less than 6 months.
Mhm. And it really was less than 6 months. I remember just because a lot of time, and this is probably TMI for most people, but most of the time when I have my deepest conversations with God is either in the shower or in my car. One of the two places,
Same.
right?
Me too.
So I was thinking about wanted to feel more fulfilled, but really wanted to live and not exist, right? And I was praying and had this conversation and was like, well, God, I don't even know where to start. Like, I'm in South Carolina, okay? Natural medicine is really not something that, is all the way in South Carolina, or
It's
readily
not a
accepted,
big
right?
thing here for real. It really isn't.
And but this was an area that I wanted to expand in, wanted to get more into, and saw the value of it. So I'm in South Carolina. I didn't have traditional training. I did not get into the space in a traditional way. And I've always had the desire to be able to create an environment that people could be healed in all areas, right? And I didn't know how to start that. I didn't know if that looked like starting a house or doing it as a community foundation. I didn't know what that would look like. But I just knew that I wanted to be at that table making decisions to be able to open the doors for people to have holistic healing, right? And I'm not saying holistic in the herbal sense, I'm talking about total
Thank
body,
you. Yes,
right?
I was just talking about that total being, right? Whole
Right,
being.
right. So that was really why I went back to get my doctorate. I said, okay, well, this is going to be the time for me to be able to sit at the table and make those decisions. I want to run this program. I want to run a community program. I didn't know what a program was, right? So I was praying in the shower and I was like, okay, God, how do I do this? And I heard it as clearly as you speaking to me. Just do it, Shayna. Just do it.
Oh, oh,
And I said, okay, I trust you. I don't know what this looks like. I trust you. And that was on my birthday, January,
what's your birthday? What month? What month?
December.
Okay, gotcha. Okay.
Okay. So I met Sarah September, October-ish. No, no, no.
October. No,
The phone number was
that was
exchanged during.
October.
Okay, that was
Yep.
October. Okay. And I also, like I telling you, I had the desire to want to live and not just exist. Okay, God, how do I live and feel fulfillment? Right? Shannon, just do it. Stop thinking, just do it. It was, I heard it clear. Just do it. Okay, fine. No problem. Call Kendra, right? Because every time I have these like, aha moments, I call my girl, right? I say, hey, I want to do this, but I don't know how to do it. So Kendra was like, cool, write the book. So I did. And she helped with the editing, all of the things. And January 1, the book was done. I wrote the book in a week. We spent more time editing
Of
than I
course.
than I
Yeah.
than
Because
I spent writing.
it was a
Right,
divine download.
right. It
And what
was.
it sounds like is that you it's almost like it was already moving, but whatever took
Mhm.
place when that connection was made in October, it starts speeding up for you.
Right,
That
right.
pressure to how
And
you
it
write
did.
this
It
whole
felt
book
like
in
a
a week.
urgency.
Yeah, that you felt
Yes.
this I remember when you reached out to me about the book. I could
Mhm,
feel that. But it
mhm.
felt good though. It felt like I gotta get this thing out of me. Like I gotta do this book. Right?
Right.
Is that how you felt?
Felt like it was right now, or if you didn't do it right now, something bad was going to happen. Like it
Yes.
felt like an anxiety to get it done. Yes. And I said, okay, fine. So, yeah, the book was done in January, and we opened it. We had our grand opening in May. It was bananas. We got the place in March, opening in May, and here we are in July.
Mm. Running a practice.
Listen, and
Running a
I'm not
practice.
well,
I
and
just
I don't
heard
want to
the
say those
doctor
words.
speaking before we started recording, y'all. They running a practice, y'all. Okay. Best believe you're gonna get some great health care. I'm a patient too. So just
Mhm.
know we're not just doing this like you're going to get the type of health care. You don't have to live with diabetes. You don't have to live with hypertension. You don't have to live with some of the chronic things and even some of the acute situations you might be going on. Pressing diagnosis. You'll be surprised. They're doctors. I call them healers. I really do. I really
Gotta
do.
walk into that because I'm just like, no. I feel like I'm just here to share and teach. That's where I put myself. I'm just here to share and teach. But when I get phone calls, oh man, I feel better. Or oh man, I never thought about it like that. I keep
Oh man,
going.
I got off my insulin.
Yeah.
Those don't leave those calls out. That's a big deal because a lot of people think it's a death sentence. A lot
Right.
of people give up. A lot of people, their health is just a representation of how they feel about themselves.
Mhm,
That's for men. That's all of us, really. Like how you feel about yourself shows on how you take care of yourself.
mhm,
Um, and I would even say, and you tell me what you think about this. I
mhm,
would even go with not to try to villainize or demonize any types of medicine, but like growing up as a
no.
little kid, I know you mentioned and integrative medicine also includes ancestral wisdom, which
Mhm.
is and I'm get back to what you were talking about just kind of with the timeline, but I feel like it was ancestral wisdom that wanted to be presented. It was like, look, we can help. We couldn't go to the doctors. We didn't have this. I remember my grandmother telling me that she had her 8 children with a midwife, and so the hospital was open in 1965 when she had my uncle, and she said, "Why would I go to the hospital if I had all 8 of my kids with her? I trust her more than I trust a doctor in the hospital." And
Listen, these women could look at you. I mean, they had such a wealth of knowledge. They
I
could touch you and say, "You're gonna have this baby this time. You're gonna be here." I mean, listen.
I just saw I got chills telling you this. I just saw I'm a nerd when it comes to stuff of watching documentaries and history things on especially people kind of debunking, and they talked about how women the infant mortality rate when they realized, when the doctors, when he had so many women dying after having the babies in like the
Mhm.
1800s, it was because doctors would leave like autopsies and go straight and deliver babies. But the thing that stood out to me about that was they said they didn't have that problem prior because midwives didn't do that. And it hit me. I thought about y'all. I was like, ancestral wisdom, midwives, and the and and just how so much of ancestral, I look at it like just earthly wisdom has almost been like discredited because you don't have a degree to support what you know.
That's it. That is it. And the thing is, that's historically that's been going on, right? And we know that. But your grandma and your great grandma did not make it to 90 something, 100 and something years old by happenstance. Okay.
No,
I
they
mean,
did not.
that's just facts. When you think about the time and the challenges that were given to them, right? Presented, not chosen, but presented, that they had to navigate through to try to just have and want everything else anybody else was want. You would want to be protected, you would want to be able to take care of your family, and you want to be healthy. Those kinds of things, I don't care what walk of life you come from or what people want, right? Equally, regardless of what you look like. But to be presented with challenges that would prevent those basic needs and still be able to navigate through that is such a respect, and it's such a way of thinking, and it's such a way of learning what you've been given. You know, God really has given us everything we need. He really has. But to be able to grab and learn what that is and how to use it is fascinating to me. And people are being helped by stuff that grows in your yard.
Mhm.
Like, what? People do not have to suffer with joint pain or heart disease, or I mean things that could be totally prevented, and this stuff has been given to you. And the amount of respect that I have grown to have for just something that simple is like, okay. And then I get teased all the time because sometimes when I get in my thoughts, like, just look at the trees, just look at the trees, and like, Shana, here you go with these trees.
No, but it's
But
true. Like
serious,
there is science that supports. I've been studying
yes,
all of this because it's like I love being a country girl. Like I brag about it.
yes,
I love it. Like,
yes.
um, I love the fact that I like to walk barefoot. We were in the county park Sunday and the field was so big and pretty. I had to go out there and just walk barefoot for a little while.
Yeah.
It was like being at the water and just wanting to put your feet in the water.
That's
And
it.
it's
Those
like
places are
grass.
energizing.
See, and
Yes.
that's the thing a lot of people don't understand. And so
Mhm.
when you talk about like being a tree hugger,
Yeah.
but the truth is the tree is healing you. Like the tree
Yes.
is a home for everybody. Like these trees, that's why the man said that's why you feel so much better when you walk in nature versus in a
Mm,
gym on a treadmill because you're getting the ions, you're getting
yeah.
things that you can't even perceive are happening. Your nervous system is picking up your
Right.
what is it? You know, doctor, the parasympathetic
You
nervous
get
system
it
is
though.
calming down,
Yeah.
right? All of those things. And I'm like, this is why I like to be outside. If I can't go to a place, I will sit in the porch. I will sit in the porch in the heat of day. And people be like, it's hot out here. I'm okay. It'll breeze. I'll sit under a tree. You know, we
Listen,
good to sit under a tree someplace now.
wildlife, I don't do. Bugs, no.
And that's funny to me to where we from.
No.
Y'all don't do bugs, and I always
Mm,
find that hilarious.
mm-mm.
You
I
just
don't do
found a way to
bugs.
live with them. You found a way to live with them.
But I mean, just to think that you can grow something that can totally help cough or help a upset stomach or help even, okay, even joint aches or fever in your yard. Like, what? And we're not taking advantage of these things. But
Mm-hmm.
And you don't have to, well, and the plants themselves are so powerful because Sarah even taught me she has a degree in a science that teaches you how to use the compounds of a plant and extract them into pharmacologic agents, right? It's called pharmacognosy. Never heard of the science
Wow.
before until meeting her. And that was her way of, getting into. I'll let her share her own story, but to realize how powerful nature truly is when it comes to healing the body. Now, you're not going to catch me outside just beat my son. Now, he loved to be outside. He'll live outside if but I don't do, like I said, wildlife. I can't. But, and I call it wildlife, but I'm talking mosquitoes, gnats, bugs, all the things that come with Charleston. I call it wildlife because they just turn up a little too much in Charleston. But
Girl.
um, But I mean, it's just fascinating. It really is fascinating to me. And when you combine it with the understanding of the science, it works. Um, but don't get me wrong, I I feel blessed and lucky to be able to have training in allopathic medicine to
Mhm.
understand the science behind the things. But like I said, just to have that toolbox and that additional knowledge on how we could mix the two is amazing. Don't I mean you just can't, you know, shortchange it in any way.
Sure, change
It's
it. So
yeah.
so what would be so if somebody's listening now and you're like, "Okay, what what can you do for me?" Right? Like I have an internist that I go to. Um I've had to see the endocrinologist, or who's the person you go to when you get diabetes? Endocrinologist, I think it
Yeah,
is.
yeah.
I've had to go to the rheumatologist. A lot of people dealing with lupus, autoimmune diseases. I go to my primary care. I have to go get these cortisol shots and things like that to try to deal with this pain. Can you help these people? Like, can these people come and see you? Um, or what do you tell these type of clients? Because what I have found, my background in healthcare for 10 years, a lot of people get so stuck on being sick, they fight for their pain, they fight for their diseases. They say things like, when my cancer and
Mhm.
my diabetes. I'm like, why is it yours? Why can't it just be cancer or diabetes? Why it gotta be your? Because your words are
Right.
powerful. And when you
It
take
is.
ownership, you come
Mhm,
into agreement with things, and people don't understand how powerful that is
mhm,
in a
mhm.
spiritual sense and how it affects your life. So for the person that may be saying, "Yeah, I hear what she's saying. Maybe I would have came to her before I had all of this going on." What would you say to that person?
Yes, the answer is yes. Like I said, you
Yes,
need
you can help them, right? Yes,
yes,
they can come to you. Yes,
yes,
like they're not too late for them to
right.
see you guys and for y'all to harness some of this power of the studies that you have of nature and just how you intertwine everything.
Absolutely. I mean, if somebody has cancer, for example,
Yes,
right?
that's a good one.
So if someone has cancer, for example, you need your oncologist flat out.
Flat out.
Do not leave him or her.
Got it. Got it.
Okay. You need your primary care team flat out. You need that. And whoever else specialists you need, right? We come as an integrative practice to walk alongside of that and integrate additional tools to be able to allow you to be able to heal from that. We're not trying to erase anybody. That's what integrative medicine is. It literally ties the two together. So okay, while he may or she may be managing how to heal your cancer, right? Whatever traditional methods that may look like for whatever staging you have and all of the complicated things that go into that, right? We also include methods for you to be able to build your body, to get you strong, to be able to fight that fight.
To fight it
You
off.
know,
Got you.
we need we integrate ways for you to, after you are healed, to be able to continue to stay that way, to get this cancer gone and stay gone, right? So I'm not God, okay? I don't come close, but I will share the knowledge that He's been allowing me to be able to share, to be able to help towards your healing, period. So we are there as an additional support to be able to do that. Now, have we seen disease reverse? Yes.
So you telling me that working alongside people, sometimes the cancer can go away and working with y'all as well? Like it's not just one oncology way, and
It
a
depends
lot of
on the
people don't
complicated.
I feel like a lot of people don't where I'm trying to go, let me just cut the chase.
Mhm,
I have found in healthcare, most patients don't trust their doctors, and
mhm,
they are dealing with very serious health issues.
mhm.
And so I'm wanting people to understand that you don't have a death sentence. I don't care what it is. What I feel like I want them to get from us right now, because I'm hearing it, I know, but I want somebody that doesn't really understand. Integrative is what it is, right? But Dr. LaShana is like, look, we keep, we will support and work with your other doctors as well, but our ultimate goal is to get you healthy and whole where you don't need any of that.
I tell patients all the time, you hit on a whole lot of things just now, in what you said. Now, for me, I tell patients, I want you to not need me.
Okay.
I want to be able to teach you so many things to where you don't need me. I want you to look at me as more of a coach than anything else and an educator. Okay. So I think that's why I struggle with the term healer, and I struggle with, I even had to come into to calling and saying, my name is Dr. Wilder, right?
Yeah, because it is.
Y'all had to work on me
Yes.
with that, right?
Yes.
So, because I see myself as a coach and an educator, I want you to pick me up in your back pocket to know that you have the support. But when you need me, I'll be there. But I want you to get so focused and so in tune with your health and your body that you'll be able to, because you live in your temple, you live in that, right? So I'm here to teach you how to be able to continue to live and thrive in that. So the first person that's going to hear the warnings is you. So I want you to know what that is, how to correct it, etc. And then, let me know when you need me. But to answer, to further address, when you have chronic disease like that, you have to be able to rebuild the body. And it is going to look non-traditional, right? It's going to look different than what you've expected it to look like. So you need to look at your lifestyle. You need to look at your sleep. You need to look at what you're eating. You need to look at your environment, how you're thinking, your thoughts,
Stress level.
all of that, all of that. And it affects you in a deep way. I tell people all the time, mental dis-ease manifests as disease in your body. A lot of things that we deal with, that we carry, my rheumatism and my this, that, and the next, are symptoms of underlying problems that have never been addressed. And that's what we're here to do. We're here to be a little bit more of a detective for people that struggle with things. The other thing that you had mentioned is about the distrust, right? In the community. I think that is what makes Magnolia different, is that we get it. I mean, all of us have a story,
Yeah.
right? And you understand, for example, I had this conversation just yesterday. If a Black woman comes to me specifically, right? And people call her dramatic, or you doing too much, or you this, that, and the next. It may be because of anxiety or PTSD that she just does not have the tools to handle. So it comes off as she doing too much. No, she
She's
just
so
need,
extra. She
yeah,
got so much drama. Or this one, she's so angry. She's
that
so
part.
aggressive. Ooh,
Yes, right. You have, but to be able to reach people in a deeper place to where you could hear, you can see and understand that without seeing all the things before you place a title over somebody is the uniqueness of Magnolia, because we understand those cultural practices, those cultural ways of communicating that other people may not see that way. Um, and because both Sarah and I have stories, we have a way to empathize with people that's a little bit different than what you may see outside of a 15-minute or a 6-minute office visit, you know?
oh
So
goodness.
we've created a space where you can feel at home when you're here. You don't have to be that girl. You don't have to, use all of the correct pronunciation of all the things of the King's English. You don't have to speak that way. You can talk to me
Yes.
the same way you speaking to your friend, because I am walking alongside you as your partner in your wellness. That's it. So I'm gonna get all in your business. I'm gonna ask you all the questions that you didn't think that was cool for you to say to your doctor. I'm gonna ask you all of the things. And it's not to get in your business. And I tell people that all the time, not to get in your business, but it's to truly understand who you are as an individual so that I can help you, period. But I think that is another factor and layer into why we so sick, because of the distrust. Some people just,
Yeah.
I ain't going. I'm
They
just
not
not
because
going.
it's like I'd rather die.
Yeah,
And it's disheartening.
it ain't gonna
It's
listen to me no
disheartening.
way.
They don't, but they don't. And
But
I've experienced I've experienced it enough to
mhm,
see and understand why people feel the way they feel. I
mhm,
feel honored that I have healthcare experience, and I feel
mhm,
like because of that, I experience healthcare a little differently. But I realize in that's why I'm so excited about you all, because especially for our men, so I want to reiterate, do you all see male patients? There are too many guys my age dealing with, kidney failure, extreme hypertension, and all of that. And a lot of that is just from a lack of taking care of themselves, checking in with somebody that could,
mhm.
and they don't trust.
Yeah.
And that's the first conversation that comes up. So I just want to make sure that you all accept male patients, and what are the
Absolutely.
age range of patients you see?
Male patient.
You
Um,
froze up right when you were answering. Please
the,
start that over again.
I say I see most of our male patients
Oh,
here.
wow, great. Okay.
If you, for that same reason,
Yeah.
um, because of negative experiences in the past, etc. Um, and as far as age ranges, we see everybody. If you live and breathe, in, we just see you. I mean, hands
So for
down.
the parent
So
that
pediatrics,
that's
we
what I was
see, yeah,
that's what I was
Sarah
gonna
sees a
say.
lot of our pediatric patients. She's
Okay.
just great with them. She's just
I
amazing
can
with
see
them.
that. I
Yeah.
can see that.
She's just
I
great with
mean, you are too now. I'm not taking anything from you, but
them. No,
I can
she
see
is.
Sarah being giddy over the babies.
She
I
is
can see
great
that.
with peds. So she sees a lot of our male patients. Um, and to be honest, we have built an amazing team of people. We have, Dr. DV is a internist and he's an endocrinologist. I mean, and he's got more
Wow.
board certifications that I can't even mention. He is a true, genuine soul
He
that is a
really is.
protector of people. I have so much respect for him. And truly, it has been an honor to work alongside him. He has taught me and continues to teach me so much. Um, Dr. Sarah, of course, is a naturopathic doctor and also a clinical herbalist, who also teaches me so much
Wow.
throughout the day. Just anytime I literally can pick up the phone and the other thing that I love about our team is that we talk about our patients, right? So there's not, especially complicated cases, and we discuss and bring all of our talents together for you, period,
I
to
love
be
that.
able to work and get
So
you where
you
you
all
want.
take an integrative approach to
Yes.
your integrative medicine. So that
Yes.
means you're practicing what you're preaching.
Yes. We
Don't
do
we
that.
love that?
Yes. It's scheduled every week,
I
every
love
week,
it.
every week. And we also have holistic nutrition, exercise, physiology, and we recently onboarded a therapist as well. So I mean, pretty much every place that needs to be hit, we have covered. Um, we work with amazing um, care management team. So, for example, if you have your grandma, right, who has high blood pressure, diabetes, but she can't get to me every week for checks or every other month or whatever the case might be, but she doesn't have a way to get her diabetic supplies or her blood pressure machines or to make sure that she's taking her medications properly. We also have a team that we work with, Toro Health, and Tracy Denson, who is another sister of mine. I have totally adopted her.
I think I know
Um,
Tracy. If that's the
yes,
Tracy I'm thinking about, she
yes,
RN.
yes, yes. I
I
love
love her.
Tracy.
I
Yes.
love her. Look,
We work very closely
and she
together, and she
is
takes
the
care of our
bomb.
patients.
That's who's taking care of y'all.
Listen,
Girl,
she
listen.
is great.
Yeah,
She is
yes,
great.
she is.
And
Oh,
Tracy is
wow.
another one that teaches me so much every day. Um, I'm really blessed to be here and working with these people. And she has a heart for people.
She does. She really
And
does.
when I need to
Genuine
get
heart for people.
yes, and when I need to get my life right, she'll say, "Okay, Shane." All she do is say, "All right, Shay," and I say, "Okay,
I
and get
need
it
to
tightened
tighten
up."
up. I gotta
Get
tighten
it
up.
tightened up.
Gotta
All right,
tighten
Shay.
up.
I love her. I love her. But yeah, I mean, that's where we are. So we
Love
really
this.
do strive to take care of the whole patient.
Mm-hmm.
And we have a team of
Mm-hmm.
people that believes in that same principle. And I cannot go without saying how we would not even be able to run this practice without our practice manager, Jessica.
Okay. Come through
She,
admins. Let's do it.
listen,
Yes.
listen,
Executive administrators. Praise God for
because
'em.
my life is shambles. I wouldn't know if I'm coming or going left or right if it wasn't for her. So I have adopted all of these people in my family. Serious.
This is what is, necessary for the road ahead
Mhm.
to take on such a feat like this. It's a blessing. This is when you know you're where you need to be because God will put the right people in your place, but you just had to move.
Yeah.
And I just thank you so much for sharing just your heart and your story. And I want all of us to understand what happened. She felt this burning desire like it's more. She was already, listen, correct me if I'm wrong. I mean, she was already dang near running the ER at an urgent care facility. Because she's already been working in very high stress, very high intensity healthcare environments, dealing with some of the most extreme situations from common coughs. I'm probably sure there were limbs hanging and near deaths, and probably some people coded in there. I mean, it's like she was working in the ER, y'all. So,
No,
the
urgent care
urgent care.
ER is different.
You're right. Urgent care ER is different,
Yes.
but I've been in her urgent care and it feels like an ER.
Yeah,
It
dude.
does. See, she try to minimize it
Yeah,
now.
dude.
She gonna try to
Some days
minimize
of
it,
the
but
week is so
many,
crazy.
many of the days that I've been in there, I'm like, what? And they move great. Great staff, great everything, but I put it like this: people know the good places to go when they need to get treated, and clearly that's an environment. And so thank you for the work that you're doing. And it really speaks to you were already doing that work. And this is what I want to speak to. Some because some people are working at that, their corporate, their 9 to 5, and but it's a passion that they have. You are passionate about healing and wholeness, just the whole being. But that wasn't it. That wasn't just it, and you could feel that almost numbing longing in your soul, like, "I gotta do more, and I gotta do more now." And more isn't always quantity. I feel like more deals more with quality. You being, a founder of one of the founders of Magnolia Integrative Medicine, in my mind, it's just like you writing that book. This is coming from your heart. Yes, I can go work in somebody else's healthcare system, but this right here, this is the way I see myself doing medicine. This is how I see myself doing healthcare. And I see that as hard work. I see that as purpose. And people are like, "What is my purpose?" That's it right there. When you say, "I got to do this." And the other thing that really got me is you told Kendra what you wanted to do. You tell your friend what you want to do, and then her thing is, "Okay, now you got to write this book." But you get the book done in a week. So thank God for friends that hear from the Lord that can speak that word into us, and thank God for obedience to hear it and do it. Because some people say, "Well, what did that it had everything to do with it." Because her book is highlighting what she practices with her patients and clients,
Mhm.
community members. I don't even really want to call them y'all patients because it's more like community members. Because it's like you really are taking that approach. I feel like I'm going to my cousin's house, calling my like it really feels
Yes,
that way, and I get healing here, which is what we grew up knowing. Certain people
yes.
you could go to and do that. So I want to celebrate you, and I want to encourage our audience to pursue that urgency, to lean into that discomfort, because she did. Everything that is uncomfortable is not wrong.
Mm.
Sometimes it's uncomfortable to shake us and shift us into a new position, into a new space. And I just thank you. I just thank you for that. I thank you for sharing. I'm also excited to have you come back, and we can talk
Yes.
more about the practice. But before we get ready to close out today, tell the people how they can connect with you, how they can find out about the practice, how they can get a copy of the books, the bundles. Let them know about all of that.
So, Magnolia Integrative Medicine is located at 1064 Gardner Road in West Ashley, uh, Suite 208. When you come in here, we've designed the practice to feel like you've come into our living rooms. So you're gonna hear your little Luther Vandross, you're gonna hear, whatever you like. It's a place that you can call home, that you can get healing. That's what we do. So we don't we do medicine differently. That's our tagline, and that's
I
really what
love
we
it.
do. Um, so you're gonna come in, you're gonna be greeted, etc. You can call us at area code 843-501-2333 or www.magnoliaintegrativesc.com. And
Magnolia Integrative SC, and no
Mag
Magnolia Integrative Medicine SC, just
no,
Magnolia. Okay,
Magnolia Integrative. Yep,
SC.
Magnolia Integrative SC, like
Gotcha.
South Carolina,
Yeah.
and .com.
I
And
love
yeah, you can book a discovery call with either Sarah or I, where we give you 15 minutes to tell us all the things. And it's a free discovery call to see what it is that you are struggling with, what you need work on or
Mhm.
advice with. We block out 15 minutes for you. That's another way we do medicine differently, because you just don't do that in primary care.
No, no.
And then we move forward and we develop a plan and figure out how we can, pick some things apart. But I mean, we're really laid back. We're here as you were saying, as community members, right? As community members that are here to help. So when you come home, I tell people all the time, you're home when you're here. So let all the things go and let's get to work.
I love it. I
Yes.
love it. So how can people get a copy of the books?
You can get a copy of the books through our website. We have some copies here in the office, but you can
Okay.
also, this might be a little bit like, what, Shayna, what are you doing? So there's also a copy of the book that you can get from something else that I'm involved with Kendra, UMN's website. So there we go.
Can you give them the website where they can get the book?
Yes. So you can go to, let's see where we have it now. It should be on urbanmasterclassnetwork.com.
Okay.
Um, where else? In our socials, it
Okay.
kind of circulated around. But if you contact Magnolia Integrative Medicine, you can also get it at urbanmasterclassnetwork.com. You
Mm-hmm.
can call us or shoot us an email.
Awesome. And how can they connect with you personally? Are you on any social media that they can follow you or see what you got going on?
Yes, it's Instagram at Magnolia Integrative SC and TikTok at Magnolia Integrative SC and YouTube. Same thing.
Awesome.
Magnolia
Awesome.
Integrative SC.
Awesome. Awesome. I love it. Well, Dr. LaShana, you and I can keep this conversation going. However, if you all are actually looking at this podcast, you can see she's in her office and she is getting ready to go see some more patients. So I know that I have to let her go, even though she's
Yeah,
being very
I
gracious.
do have a
Eh,
1 o'clock.
See, and I definitely want to give you your time and give you your space, but we just here at the Heartline and our whole Heart Tribe community, we really thank you for being here. We thank you for one being a member of our community because she is definitely one of our Heart Tribe members. And I also just want to thank you for who you are. And I'm sure you've heard of the concept be do have. You definitely embody this being that has led you to a doing. So whatever you may or may not have right now, just know it's on the way.
See that?
Because you're doing the work of the Lord and you have more than you realize. Continue to tap in and lean in, and I thank you so much for this time. And I really wanted you here because I wanted this season, I want the Heartline to be a resource. Like I get on here and you push me a lot with hard work and having the conversations, but I want the people to see the people that I talk to in the background or hear some of the conversations we're having. Because when we have personal conversations, it sounds a lot like this podcast. We just
Yes.
it up a little bit. But I mean, very similar. Maybe not as geeky
Yes.
as our private conversations usually are, but y'all can catch it. If you're not from Charleston, you're like, what are they? Jamaican? Where are they from?
No.
Bahamas? But no, we geeky. We gullah geeky. And I'm just thankful, and it's reminding me to keep going. And that's why I want to encourage you. So I'm excited about you coming back. We're going to have Dr. Sarah on, I think, when you guys come back, and we're going to talk more about the work that you all are doing. And just, this is how we grow heart equity, y'all. And I thank you for putting your money, your time, your talent where your mouth is and really doing it. So for you all who are out there looking for a new medical practice, I just had a family member went to the doctor and was just like, my doctor increased my blood pressure medicine, and I said, "Why?" And they said, "I don't know." That frustrated me. I said, "So, did you take the higher dosage?" They said, "Yeah." I said, "Absolutely not. That's not what we're doing." They need to be able to explain to you why we're going up on this dosage, and if they can't, then we can't do that right now. I need it. Did they ask you what your life experience is like? Did they ask you, did anything change at home or in your personal or professional life that could be impacted? She said, no. I was livid because you just increase a blood pressure. Girl, okay, that's a whole nother podcast. See,
Yeah.
that's what I meant. See, y'all, I'm sorry, I should have brought that up a little earlier, but This is an example of why I want everybody to go to Magnolia Integrative Medicine. You do not even have to live in South Carolina. You can
Mhm.
still reach out to them. They can work with you. I also want to highlight that they do accept many major insurances. So don't feel like because you hear integrative that your insurances, you can reach out to them directly. She gave you the phone number. We will have all of that information in the description so that you all can reach out to them directly. But this is what you've been asking for. You've been afraid, your body is changing, you're nervous, you don't know what to do, your loved ones have passed, suddenly scared you. You don't want to be like that, but you're not quite sure. They can help you. You need a therapist. If you're in a domestic violence type situation, these providers can help you. Okay. If you've experienced extreme trauma, you heard Dr. While they talk about the person that comes into the office that everybody else misunderstands, but she has enough wherewithal, or at least ask some more questions and diffuse the situation. I know somebody heard that, and you could see yourself in the office going through that. This is the practice for you. They are the real deal. You know how they say she really is like this in real life, for real. She really is like almost everybody connected to me one by one are just switching over to Magnolia. So I just want y'all to know this is not fluff. She did not pay me to be on here. I asked her to come on so we could talk about this stuff because it is just that important. And with me and the hard work that I do and how important I know it is for us to get our emotional pain out because of the impact it has on us physically, spiritually, and all the other things. For to have practitioners, providers that understand that, and they don't just understand that, they can help you in
She